My name is Dr. Randolph Wolf Shipon, and I'm a psychologist in Mountain Lakes, New Jersey. I have developed a therapy that is or is not a psychotherapy. I haven't decided yet. I don't think it is, but I haven't decided yet. And I'm calling it a behavioral treatment. It is an evidence-based treatment, which is an EBT, called extremely brief therapy, which is an EBT. It's a 3-session therapy, so that's another name for it. And that is the name of my new book on Amazon.com. The therapy is brief, behavioral, efficacious, non-cognitive, objective, expensive, and a skill. And again, there's a question about whether it's a psychotherapy because it is a behavior therapy. Psycho implies that something is happening in the mind. A behavior therapy deals with observable and measurable behavior and thus does not spend a lot of time paying attention to the mind. So this short audio is the training for EBT. I first want to mention that 3-session therapy, or EBT, is a therapy that was developed for psychotherapists to carry out, but then I realized that behavior therapy is an unregulated and unlicensed field. It is only certified through certifying agencies, but behavior therapists generally do not require any kind of licensure. They usually operate under the auspices of some other organization, or you do a behavior therapy when you're doing any kind of coaching, whether it's job coaching or you're doing the kind of performance review that you might have at work, or when your athletic trainer says, do this, not this, do this X number of times, we're targeting this weight or this strength level. These are all behavior therapies that don't require you to be a psychotherapist to perform. So the question about whether you're performing psychology with or without a license or counseling or social work is rendered irrelevant because behavior therapies don't require a license, at least as far as I know. But that is not to say that it can't be a psychotherapy, because it is, of course, minted in the behavioral tradition, specifically the tradition of radical behaviorism, which takes only a glancing view of the role of the psyche. The psyche isn't terribly important. It's what you accomplish that's observable and measurable, as if there were a silent movie playing and you were able to watch everything without any words. Behavior therapy should be able to do that. So I'm going to explain to you in this short video the process that you will be tested on regarding EBT. First thing you need to know is that EBT is semi-satirical. It is a legitimate therapy that will achieve legitimate gains, but it is a therapy that is very tongue-in-cheek because it makes fun of a few trends in psychotherapy. The first thing that, I guess I did in developing EBT was I saw that a big trend in psychotherapy was CBT in my life. And then another big trend in psychotherapy was DBT, or dialectical behavior therapy, which I also trained in somewhat. And then I realized I needed to be the next one, so I had to be EBT, which is extremely brief therapy, because I had to be the E. If we already had a C and a D, it appeared we were going in order. So that's the first thing that was satirical. The second thing that is more of a commentary on the state of our society in America is that I needed a therapy that would be highly desired by the health insurance companies that pay for mental health treatment, but unavailable to those companies. And there's a reason. There is a moral declaration being made by the EBT therapist. The moral declaration that is being made is that, number one, health insurance companies are a bad deal, especially when they are withholding care from you. The industry of psychotherapy, like other fields of medicine, are facing increasing scrutiny from the health insurance companies on how often we treat, what kind of treatment we use, etc., etc. And in my book, which again you can find on Amazon, 3-Session Therapy, and it's called Extremely Brief Therapy and Evidence-Based Treatment. Notice how I get all those EBTs in there? And there's one more set of EBTs that we're going to talk about in a second. And that's because each letter of EBT names a session of the therapy. Okay? But in any case, the health insurance are giving you a bad deal because what you do is you pay a premium and then the insurance company hopes that you never get sick. And then the money that you're paying into the system is ultimately withheld from you when you try to claim your care needs. And 2020 witnessed the advent of a whole bunch of new procedures at a whole bunch of the insurance companies where now they need you to reauthorize something that you always had before. So this is theft. What it amounts to is that the insurance companies, they try to get you to pay a premium, and then they try to withhold the care from you so that they can save the money up for, I guess, their top executives or their advertising campaigns or whatever they feel like they need to be spending money on. So we are not happy with the insurance industry, and that is why, as a therapy that they will very much desire, because this therapy is a behavior therapy with measurable results that will get good outcomes, we're strongly encouraging EBT therapists not to accept insurance at all. And the reason is that we have evidence from many fields that people value what they pay for and pay for what they value. So people don't ask a question if the plumber comes or the electrician comes or somebody paves your driveway or you go out for a fancy steak. We want therapy to be more valuable than all of those things. In fact, it is. Only therapy can give you hope, save a life sometimes, help you overcome a problem that you couldn't overcome, move you past a stuck point in your life that you were always stuck with before. So we believe that a behavior therapy that is restricted to 3 sessions, which doesn't trap people in psychotherapy forever, but gives them a discrete number of sessions that they will be, very happy with. We believe that this is something that the insurance companies will want, and they can't have it. Instead, we are going to make people pay up front for the entire therapy. And this is the process, and this is where we get into the science, so I need you to know this. If you are listening and you are not a person who has access to a really scientifically valid outcome measure, like the one that we use, which is called the Treatment Outcome Package from Outcome Referrals, you have to go get one, okay? Go get yourself one. I like the Treatment Outcome Package. It's very nice. The first thing that you do is you have people sign all of their paperwork as is appropriate and advised by your attorney for rendering a therapy. In psychotherapy, we have that built in, okay? Other people who are going to use this method are going to have to check with the legalities on things like coaching using EBT. I imagine it's possible. I just think you have to protect yourself legally. So you have them fill out your paperwork, which involves the intake stuff. And as they're doing that, they fill out your assessment tool. That's the first step before you even get into the first session. You look at the results of that assessment tool to see if the things that have been identified on that assessment tool are in the clinical range, meaning in the moderate to severe range of psychopathology. And if it is, guess what? They don't qualify for EBT. EBT focuses on the problems of the worried well, which is what a lot of psychotherapists would like to be doing anyway. All right? It focuses on the problems of people who are committed enough to their care to be able to pay for it up front. They pay for other things up front. Cigarettes, alcohol, food, steakhouse, a night at the club, they can pay for EBT up front, and they should make it an investment. And, we want to make sure that people will have the resources psychologically to be able to carry out a therapy that focuses on 100% self-efficacy. The Stoics, the Roman philosophers, the Stoics would be very proud of this therapy. It is, at its essence, how the progenitors of cognitive behavioral therapy came up with their stuff. Albert Ellis, Aaron Beck turned to the philosophies of ancient Rome and Greece, and they culled wisdom that they turned into a thought therapy. But here we're turning it into a behavior therapy. So you get your pre-test, and if they're clinical, you refer them to a psychotherapy practice, or if you're doing psychotherapy, you can refer them to your practice. That's fine, although I suggest that you do EBT because it's easier. The first session is examination. Just like an EBT, it's extremely brief therapy and evidence-based treatment, another EBT. Now you have EBT, examination, bargaining, and termination as your 3 sessions. So here's the first one, examination, session 1. You review the case with the client, you clarify 1 to 2 broad goals, and you go over the results of the pre-test, and you tell them that they're not clinical, because if they're sitting with you, remember, they're not clinical, otherwise you referred them. And you clarify 1 to 2 broad goals. Then you tell them the next step of the process, which is that you are going to have a secret meeting with other EBT practitioners. And you're going to anonymously consult on the case. In other words, your other EBT practitioners aren't going to know who the person is. You're going to tell them basically the problem, and they are going to suggest 10 objectives that they will help you craft very behaviorally. And here's the key: in the secret bargaining session, the targets or the objectives that are observable and measurable have to be only 10 to 20% more than what's happening already. There's a reason for this. We want to make the behavioral objectives achievable. So that's what happens in the secret review session. And only after that information is gathered can you go into session 2, the B in EBT, which is bargaining. Session 2, that's where I bring all the objectives suggested by the secret EBT meeting. And I say, here are the experts who suggested these behavioral targets, or what we call objectives. Which ones can you commit to? You have to pick 4 of 10. This is a very important part. It doesn't matter whether they have 1 goal or 2. You still need to pick 4 out of 10 of the objectives. It's arbitrary, but 2 per objective, or 4 total, is a good number for people. 4 targets. And you hold them accountable for these targets. Here's how you do it. You say, in 30 days, you're going to be taking a post-test, and only after you take that post-test can you meet with me again to review your 4 objectives. So, you emphasize to them that they are doing this on their honor, under their own power. They are not going to get any support between sessions 2 and 3. And then between sessions 2 and 3, between bargaining session and termination session, after 30 days ensue, they take a post-test. They take the post-test that is the same as the pre-test to see how their stress levels have changed, if their feelings about various areas of their life has improved. And then you go into the termination session. After you get the results back, that's when you schedule the termination session. In session 3, you review the differences between pre-test and post-test, and you give them a certificate that says that they completed a 30-day therapy called EBT. That is it. That's the whole process. And the only way to get trained on EBT is to listen to this recording or watch Sarah's whiteboard video and be trained by me on it. And then what's going to happen is you're going to have a test to certify that you know the answers about EBT. Just the stuff that I covered. So review this video again, and then review it again another time, and I'm going to test you on it for your certification in EBT, extremely brief therapy or 3-session therapy, and evidence-based treatment, which has 3 stages. It has examination, then there's a secret stage, which is the secret EBT practitioner consultation. Then there's bargaining, then there's termination, and then you're done. That's EBT in a nutshell. We are getting some supporting materials created, goals and objectives totally carried out by the person who's presenting for the therapy. Cash up front, not psychotherapy, but a behavior therapy. If you have any questions, please reach out to me. Our websites are extremelybrieftherapy.com, 3-session therapy, spelled both with the number and written out. And there's actually a website called notpsychotherapy.com. They should all go to the same place. That's where you will find the link to the book on Amazon, where you'll find some more information and the original impetus for the project. And you will also find the certification course and certificate generator for that. If you have any questions, please reach out to me, and thank you so much for listening to this presentation on EBT, an evidence-based treatment called extremely brief therapy or 3-session therapy. Let's go change some lives.